The truth about vaccines. Are they really safe and effective? Vaccines have been one of the most groundbreaking advancements in medical history, credited with eradicating deadly diseases and saving millions of lives each year. Yet, questions about their safety and effectiveness still arise in public discussions. Are vaccines really as safe as experts claim? Are they truly effective, or are there unseen risks? To understand the current landscape of vaccines, let's start with a look at their history. The concept of vaccines dates back to the 18th century with Edward Jenner's discovery that cowpox could protect against smallpox. This groundbreaking idea laid the foundation for future vaccines. 1796, smallpox vaccine, the first successful vaccine. 1885, rabies vaccine, developed by Louis Pasteur. 1955, polio vaccine eradicated the disease in many parts of the world. 1980s, widespread immunization efforts against measles, mumps, and rubella. From these early breakthroughs, vaccines have evolved into a crucial part of public health. But with this growth comes the need for rigorous safety and efficacy testing. How do we ensure vaccines are safe? When you receive a vaccine, your immune system is essentially being trained to recognize and fight off specific pathogens. Vaccines contain weakened or inactivated parts of a virus or bacteria, which stimulate your immune system without causing disease. This process creates memory cells that remember the pathogen, so if you encounter it again, your body can respond quickly. Vaccines undergo one of the most rigorous approval processes in the medical field. There are 4 main phases in vaccine testing, each aimed at ensuring safety and efficacy. Preclinical trials, tests in labs and animal studies. Phase 1, small human trials to assess safety. Phase 2, expanded trials with more participants to gauge immune response and refine dosage. Phase 3, large-scale trials to confirm safety and effectiveness across diverse populations. Even after approval, vaccines are continuously monitored for side effects and effectiveness through post-marketing surveillance, ensuring any rare side effects are quickly addressed. CDC, FDA, and WHO constantly monitor vaccine safety. Common concerns and misconceptions. Despite these rigorous processes, some concerns and misconceptions about vaccines persist. Let's look at a few of the most common questions. Do vaccines cause autism? This claim originated in 1998 from a now-debunked study by Andrew Wakefield, which suggested a link between the MMR vaccine and autism. However, numerous studies since have found no evidence to support this claim. In fact, the original study was retracted, and the medical license of the lead author was revoked. Extensive research shows no connection between vaccines and autism. Are vaccine ingredients harmful? Many are concerned about the ingredients in vaccines, such as aluminum, thimerosal, and formaldehyde. However, these components are present in trace amounts and have been studied extensively for safety. For instance, thimerosal, a preservative containing ethyl mercury, is used in extremely low doses and is not retained in the body. Common vaccine ingredients are present in safe, regulated amounts. Vaccine efficacy. Measuring protection. The effectiveness of vaccines varies by type but is generally high, reducing disease spread significantly when a majority of the population is immunized. Vaccines can be classified into several types: live attenuated, inactivated, mRNA, and more. Each works differently but aims to prevent disease in a safe manner. Vaccine effectiveness can range from 7,099% depending on the disease. The key measure of vaccine effectiveness is often seen in real-world studies. For example, diseases like measles and polio saw a 90% reduction in cases after widespread vaccination. Side effects and adverse reactions. Like any medical intervention, vaccines can have side effects. These range from mild, fever, soreness, to extremely rare severe reactions, anaphylaxis. Extensive safety protocols are in place to identify and manage adverse effects. Common side effects are typically mild and temporary. According to the CDC, severe side effects occur in about 1 in a million doses. This makes vaccines one of the safest medical interventions available. Herd immunity and public health benefits. Herd immunity occurs when a large portion of a community is vaccinated, which makes the spread of disease less likely and protects vulnerable individuals who cannot receive vaccines themselves. This concept is critical for diseases like measles, where herd immunity requires around 95% vaccination coverage. Herd immunity protects the community and vulnerable populations. Case studies, vaccination success stories. Let's look at some powerful case studies where vaccines have proven highly effective. Smallpox, once a deadly global killer, was eradicated in 1980 thanks to vaccination. The polio vaccine also nearly eradicated polio worldwide. And more recently, COVID-19 vaccines have saved millions of lives by reducing severe cases and hospitalizations. Vaccination success stories: smallpox, polio, COVID-19. The dangers and effects of declining or rejecting vaccination. Vaccination not only protects individuals, but also contributes to broader community health. When people decline or reject vaccines, it impacts more than just individual health. It can lead to public health risks with potentially severe consequences. Here's a breakdown of the most significant dangers and effects. 1. Increased spread of preventable diseases. When vaccination rates drop, infectious diseases that were once under control, like measles, mumps, or whooping cough, can resurge. The spread of these diseases often hits vulnerable groups the hardest, including young children, the elderly, and those with weakened immune systems. Measles, for example, is highly contagious and can infect 90% of unvaccinated people exposed to it. 2. Herd immunity breakdown. Herd immunity relies on a high percentage of the population being vaccinated to prevent disease spread, protecting those who can't be vaccinated, like infants and immunocompromised individuals. When enough people decline vaccination, herd immunity collapses, increasing the risk of outbreaks. Diseases like measles require around 95% immunity within a community to prevent outbreaks. Dropping below this threshold can lead to widespread illness. 3. Higher risk of severe illness and complications. Individuals who decline vaccines are at risk of experiencing more severe forms of certain diseases. Diseases like chickenpox, influenza, and pneumonia are generally milder in vaccinated individuals. Those who are unvaccinated are more likely to suffer complications, such as pneumonia or meningitis from measles or paralysis from polio. 4. Increased healthcare costs. Treating preventable diseases imposes a significant financial burden on healthcare systems. Outbreaks require costly interventions like hospitalizations, medications, and in some cases, emergency treatments. For instance, a single measles outbreak can cost hundreds of thousands of dollars in medical expenses and containment efforts, straining public health resources and raising insurance premiums. 5. Impact on economic stability. Widespread disease outbreaks can lead to absenteeism in schools and workplaces, impacting productivity and income. As people fall sick, they miss work or school, affecting productivity. Parents of sick children may need time off, disrupting household incomes and contributing to a broader economic slowdown. During influenza outbreaks, businesses often experience reduced output, especially when a significant portion of the workforce is affected. 6. Threat to global health efforts and disease eradication. The success of eradicating diseases like polio and measles hinges on high vaccination coverage worldwide. When communities reject vaccines, it hampers efforts to eradicate diseases globally. For example, polio has reemerged in areas with low vaccination rates, undermining years of international eradication efforts. This not only affects the local community, but can also lead to international spread. 7. Risk of mutations and resistant strains. Unvaccinated populations can become reservoirs for diseases, allowing pathogens to mutate or develop resistance. The longer a virus spreads unchecked, the higher the chance it has to mutate. Mutations can make diseases harder to control, requiring new vaccines or treatments. For example, flu viruses constantly mutate, necessitating new vaccines each year, and COVID-19 has shown similar behavior. 8. Loss of trust in medical science and misinformation. Spread low vaccination rates are often associated with increased misinformation and declining trust in public health advice. When communities reject vaccines, it can fuel conspiracy theories and misinformation about vaccines, leading others to refuse vaccination as well. This cycle perpetuates fear, confusion, and skepticism, making it more difficult for public health authorities to control outbreaks and educate the public on science-backed health measures. Rejecting vaccines affects not only the individual but also public health, economic stability, and the global fight against preventable diseases. Declining vaccination may seem like a personal choice, but the resulting health and societal impacts make it a community-wide issue. The safer and healthier choice, supported by years of scientific research and data, is to vaccinate and contribute to a protected, resilient society. The future of vaccines, emerging technologies. New vaccine technologies like mRNA vaccines used in COVID-19 are transforming the field. These vaccines can be developed faster and have shown promise in tackling other diseases, including cancer and influenza. Researchers are also exploring DNA-based vaccines and viral vector vaccines to broaden their impact. Future of vaccines, mRNA, DNA, and beyond. Vaccines are not only safe and effective, but are one of the most significant tools in modern medicine. From rigorous testing to real-world effectiveness, vaccines play a crucial role in reducing disease and improving quality of life globally. The next time you get vaccinated, remember, you're not just protecting yourself, but also contributing to a healthier, safer world for everyone. Subscribe for more insightful content. If you found this information valuable, please like, subscribe, and share. Join us as we explore more topics that impact your health and well-being.